Assalamu alaikum and welcome to all the participants from APPNA Merit Group and to our respectable, valuable and most seasoned professional Dr. Minhaj A. Qidwai. Let me briefly introduce you up to Dr. Qidwai. He is a graduate from Dow Medical College, Karachi, Pakistan in 1984. He did his MBA and MPH from University of Hawaii and Oklahoma and certification in management consultant from Canada. He is a faculty member, American Institute of Healthcare Quality, and affiliated with many other such organizations. He's also the president, Karachi Bridge Association. So these are the interesting activities, and on the board of trustees of several other organizations. Dr. Qidwai has more than 3 decades of international experience in health management, administration, marketing, research, human capacity building, and academics. Dr. Qidwai was one of the lead person in establishing the concept of ethics committee in research and quality circles in healthcare in Pakistan. He is the pioneer for initiating MBA in health management in Pakistan and for health systems improvement programs at College of Physicians and Surgeons Pakistan and Institute of Business Administration. As a chief executive officer, he established the Sindh Healthcare Commission, Healthcare Regulatory Authority in Sindh, Pakistan. Currently, he is involved in the development of a Center for Health Innovation and Transformation. Dr. Qidwai holds the dual nationality from Canada and Pakistan, and he is the author of a book, A to Z of Healthcare Quality. At present, he is also involved with the Special Assistant to Healthcare, Dr. Faisal Sultan, to develop some of his initiative in vaccinology, in re-engineering National Institute of Health, Pakistan, and a few other initiatives. We are very excited and we welcome very warmly Dr. Minhaj Qidwai to share his thinking and his planned intervention and his role and as a change and catalyst to the healthcare industry and ecosystem in Pakistan. So over to Dr. Minhaj Qidwai, please, you can start your presentation and you can share the screen, please.
Thank you very much. Bismillahirrahmanirrahim. Thanks for APPNA Merit for providing this opportunity for me to present this innovative, unique concept that I have come up with for Center for Health Innovation and Transformation. This is the disclosure statement I was asked to present. So first of all, we have to see exactly that recognition of importance of research and innovation in Pakistan. And I would like to present some information in that regard, that Office of ORIC was established in 2011 by the Higher Education Commission of Pakistan to make research a top priority. To share some data, only 38% of universities have established ORIC, that is 71 out of 188. Only 54%, that is 38 out of 71, have developed technology and innovation support centers. So that leaves us with only 20% of, that is 38 out of 188 universities having their focus on audit establishment and towards research. So in a decade's time, this is something, a dismal status that I came up with. So I thought that something needs to be done as a catalyst agent in this area where we can push this research and development and the status of audit in Pakistan. So the main pillars for innovation are the government, academia, and industry. The government is responsible for financing, policy formation, innovation support, and advisory services. The academia is responsible for research and development, education, incubator setup, and spin-offs, while the industry is responsible for the entrepreneurial venturing, product, and service development. These activities are for the stakeholders, which are important aspect in this area, which are the organization, companies, universities, and then that have an impact on the ecosystem of the country. So just want to present a logic model for approach for innovation, which is standard is input, process, output, outcome, and impact. And the inputs are the resources, the throughputs are the processes, which brings a result. And then the expected results, outcome, and the impact of the goals. And then from the outcomes, we have a feedback from the environment to reassess and realign our inputs to bring changes. When these innovations and are put into the efforts and maturation, we have the innovations which start with the discovery, development, testing, demonstration, and ultimately commercialization. But again, we get feedback after demonstrations, and those is aligned into the discovery, and the whole circle goes along. However, when we are starting any project or any innovation, we get some challenges in terms of input challenges I have put over here. And these input challenges I have put into 4 categories as far as the self, systems, society, and state. Now, when we are dealing with any project, the input challenges, everybody is asked, what's in it for me? So they're all looking for what are their personal goals or gains in any project. In society, we deal with the working ethics in the society, literacy rate, behavioral aspect of society. So we deal with these issues as a challenge in the innovations and transformation. Then the state issues are the funding and policies as specified earlier. Then there are the system issues, which is bureaucracy, politics, issues with empowerment of grassroots. Unfortunately, 18th Amendment did bring up the devolution, but the transfer of powers from the provinces to the district when the usage level is still not there as such. So there are issues with empowerment of the grassroots level people. There's a disconnect between the academia and industry, the lack of trained professionals, health systems issues, health policy issues, service delivery issues, and the quality. So these are the general input challenges that we have to keep across when we are dealing with any kind of innovation or on a project, for instance. So these challenges need to be addressed through research and innovations, education, human capital development, for transforming the community, economy, and human capacity for quality improvement in service delivery and economic growth. Now we have the government, the university, and the industry, and they are playing their own role. But in the center, we have the learning and innovation, and somebody has to play that role as a catalyst. And therein, basically, we bring in the role of the Center for Health Innovation and Transformation. So the vision that we came up was to lead, connect, innovate, and transform healthcare to achieve a society of healthy communities. And the mission is to develop a system with resources from the stakeholders, state, society, self, in collaboration with institutions, academia, industry, thus providing a platform for innovations in healthcare, for economic growth, and developing human capital for transformation leading to quality improvement in service delivery and economic growth. So Center for Health Innovation Transformation, the first role is innovations in healthcare. And as we can see that there are five basic pillars in this case, which are the university, institutions, the industry, and the state, self, and society. And then all these leads towards the commercialization and economic development and the impact on the environment. So what Center of Health Information and Transformation tends to provide a platform for the stakeholders for economic growth, for auric development in the universities, as I pointed out earlier in my presentation regarding the status of the auric development in universities, industry academia accelerated bridge, diaspora initiatives of entrepreneurs, researchers, scientific community, and today's presentation is an example of that. Now, our current projects that we are having in hand are for honey healing patch, home health services for patients, telehealth, and cancer screening. This honey-based wound care patch for treatment, as we all know that there's an inflammatory phase, proliferative phase, the remodeling phase, and the hemostasis in the wound healing process. And this honey-based wound care patch replaces the conventional wound care products. It's a low cost, with high accuracy, with quality of care, and with precision control of easiness to use and store. Our second project is home health services. Now here the services are being offered at homes, especially this is focused more currently on the geriatric patients and those who are elderly. As we all know that in Pakistan, we don't have these kind of geriatric treatment centers or elderly care centers. So this is a service that has been developed. But at the same time, we are in process of developing this patient-centric app in development, and we are looking for sponsors and partners in development of this patient-centric app that will bring the home health service on our mobiles. Another application that we have developed is hospital an application, and all the services that are provided in the hospital that are available in an application. But again, we need some kind of investment in terms of the marketing and development further of this hospital application. Another interesting project that we have is a cervical cancer screening technology. This is a lens-free computational imaging device developed in over 12 years at UCLA School of Engineering. Digital imaging platform optimized for capturing digital images of pap smear slides and screening for cervical cancer. This replaces the analog microscopes, and the FDA approval is expected within 30 to 38 months of funding and valuation of 2.1 billion by year 7. And this is the instant diagnosis tool using local and cloud-based artificial intelligence neural networks. So this is a Canadian-based company that has collaborated in the moment. Servicheck is the name, and again, this is a low-cost device, costs only 10-25% of conventional high-end microscopes. It's highly accurate, large field of view, allows quick diagnosis and classification through a neural network of thousands of samples with the option of cytopathologist oversight. And then the quality of care provides rapid identification of normal samples and classification of abnormal cells for accelerated action by the physician. And then the physician control is also there, which provides the physician with an in-house tools to enable end-to-end diagnosis within minutes without involving offsite labs and thereby increasing their revenues. This reduces the waiting time of the patient at the clinics. Now, as I mentioned earlier, that Center of Health Innovation and Transformation is there to provide a platform. And I want to share this recent example of this new system that we are trying to develop, where Pakistan Science Foundation had offered for a funding, and then we developed a proposal with the Department of Food Science Technology in the Karachi University. Center of Health Innovation Transformation has an MOU signed with the University of Karachi, and they approached us, and then we worked on that project. And then the Center of Health Innovation Transformation identified a food-based industry which is by the name of organic, and this is a proposal that we have developed. And this proposal is development of a quinoa market as a major export from Pakistan. Quinoa is a seed with high protein similar to rice. It can be used as substitute to rice also. It's beneficial for celiac disease patients due to low level of prolamine and glutamine content. And our industrial collaborative organic has successfully grown quinoa in region of Punjab, Tharparkar, Nagar Parkar, yielding about 12 kilogram per acre. And C.H.I.T connected the industry and academia for funding for economic growth. So this is a recent most example that how we are functioning at the moment. Our business partners in innovation are ZOC Group, which are innovations for disruptive transformation towards knowledge economy, and they have a dream of innovative nation like myself, innovation in Pakistan. And our business partner in project management. Now, one of the important area where we intend to support our younger generation, which are in the incubation period and they are developing in terms of the products, that they should understand how the project is managed. And for that, we have partnered with the Blue Peaks, which is the only registered premium authorized training partner with PMI USA in Pakistan. And we have a team of seasoned professionals in it, in IT, project management, healthcare, artificial intelligence, databases, and soft skills. So our core team for Center of Health Innovation Transformation, myself and my 3 young colleagues whom I have engaged in this project. Now, other arm for the Center of Health Innovation and Transformation is the Human Capital Development and Community Empowerment. And for human capital development, we have picked 5 key strategic areas, which are the youth, grassroots level, middle management, senior management, and senior executive management. And we intend to launch several programs, especially for youth. I would say that we are working currently on a program of the quality circles among the youth population. The quality circles are very well recognized in the corporate sector, but we intend to introduce this program among the youth to prepare them for the tomorrow in terms of their corporate level entry. So we are working on this project at the moment with the industry in Pakistan. And apart from that, in terms of the grassroots level, we are currently working with different institutions for offering grassroots level programs in terms of physician assistant management, dental assistant management. And one important project that we are developing with another institution is to develop the capacity of midwives in their business development. So midwives, I would say, are the key in terms of the backbone of the healthcare system in terms of the maternal and child health care. So they are usually there, but they are only exposed with the clinical aspect. They're not exposed with the management aspect and the business aspect. So we intend to develop a program where we can teach them some basic functions of accounting, marketing, and management and communication skills, so they can expand their business and do business successfully. From middle management perspective, we have developed some programs for the pharmaceutical reps and pharmaceutical managers, and they are currently in offerings. For senior management, we have programs in terms of director level programs, and for executive senior management, we have programs that we are developing in terms of the CEO level programs and also board management programs. So ultimately, we'll be bringing a transformation through this knowledge exchange and human capital development affecting the environment. Now, human capital development and community empowerment, the focus is basically on quality improvement, which education on the individual self, educating society and state, systems improvement, training and developments. We also intend to offer internships in different institutions, and community empowerment. So to summarize the presentation, Center for Health Innovation and Transformation has two arms: the innovative arm, which is going to transform through knowledge in terms of engagement of the institution, the university, science and research, industry. Commercialization will take place with the involvement of the state, self and society, ultimately leading to the economic growth. And then the other arm is the human capital development and empowerment of the community, and transforming through knowledge in terms of the youth, the grassroots level, middle management level, senior management level, and executive senior management level. For community awareness and empowerment, we have just initiated our newsletter, and we intend to develop programs through the YouTube channels, learning management systems, and e-learning. Now, our partners in this case, as I informed earlier, we have signed MOU with Karachi University, and we are currently focusing on the development of the ORIC in Karachi University, and we are helping them in engaging the new cohort of the incubation centers that they are developing. And also, we intend to develop the ORIC development program through the Karachi University in terms of the trainer program we are developing. And this we are trying to focus on, especially in the medical universities and other universities where there's more important in terms of development of ORIC. We also have a MOU signed with the PF-KIT, and with PF-KIT, we are focusing on the youth sector, where the youth they are involved in some innovative products from the IT sector. So they are working on that project, and we are helping them in terms of their support. And also, we are developing a professional development center with PF-KIT, where we will be offering programs in terms of general population for the healthcare sector. We are also partnering with the Consumer Association of Pakistan. This is a very strong arm of consumers, and I'm the chairman of the healthcare committee, and we currently are planning to launch a program that will focus on the patient rights and responsibilities, doctors' rights and responsibilities, and all health hospitals and the healthcare establishment rights and responsibilities. So we can expose them to their rights and responsibilities, which is a very important area. So from consumer platform, we will be launching these programs. Blue Peak is associated with us in terms of project management. Nanolucent is a Canadian-based company that is associated with us in developing of the cervical cancer screening program. We will be developing some program with them in terms of the creating awareness about the preventive areas of cervical cancer, and some focus group discussions we'll be holding with them. Health Yabi is the home health service organization. Zog Group are our partners in innovation. Organic is the company that we have engaged for the project for the Physicians University in terms of nutrition and health solutions is the innovation that is basically there for in terms of the hospital app that we already informed. Now, my last slide is basically on the earlier logic model that I put earlier in terms of the input, processes, output, outcome, and impact. And I would like to suggest a way forward over here from this platform, and where I would like to put that APPNA Merit already has programs for the medical education research, international trainings, and transfer technology. And APPNA Merit is basically based in US and also caters to North America from Canada also. So I strongly putting forward that the inputs should be received from the APPNA Merit and these inputs basically the projects and all these offerings that are being made by the APPNA Merit through this platform and others, they transfer these programs as an outsourcing, or we call it business process outsourcing. So these processes that APPNA Merit would like to undertake, they can be outsourced to uh, the Center for Health Innovation, and we can provide support services for the programs that APPNA Merit would like to outsource in Pakistan. And then, as I said earlier, that once we develop a program, then we have all the outcome that will be beneficial for APPNA, and ultimately this will have impact on Pakistan. So I will reiterate that if we have APPNA offering programs from North America and we want them to have an impact in Pakistan, we need to outsource them whatever the way modalities can be. And Center for Health and Information Innovation and Transformation is a platform where these projects can be outsourced through us, and these outsourcing definitely will affect the APNA organization also as such, and ultimately will have an impact on Pakistan. So I thank all of you for patiently listening to my presentation, and I would like to hand over to Uzair Saab for further continuation.
Thank you very much, Dr. Minhaj. It's very enlightening presentation, and in a very graphical way, you have tried to elaborate all aspect and the smooth transformation in this segment. I have with me the main functionaries of APPNA Merit Group, Dr. Mustafa Siddiqui and Dr. Shahid Rafi. So thank you very much for joining. And maybe I think I will hand it over to them for some of the questions, but I have one basic question before that. So as of today, I was just trying to figure out what is the corporate structure of this Center of Innovation. Is it a NGO? Is it a commercial organization? Is it a public-private? So what's the corporate structure of this organization?
Well, I have a consulting company by the name of Unet Consultants, and we offer consulting services. So currently, I am initiating this project under my consulting company to start with, because we just started this project. So this is a project under my company, and I'm funding myself at the moment. But definitely, I'm looking for like-minded partners who are interested in development of research and innovation in Pakistan. So I can partner with them and then grow this further, and then ultimately make it into a corporate entity.
Okay, so just continuation of the same question. You mentioned about your vision and mission about running this thing. So I have just a question, from the portfolio angle, you are a management person in addition to a medical doctor. So, when you are targeting so many diversified activities, so is there any prioritization in terms of selection of these things, where to grow, how to grow, and what are the priority areas, so that the interested people from here they can give some input. So will you be able to define your priority area out of this portfolio?
I think the main priority is the development of ORIC in the medical universities because that's what important and need of the hour at the moment. At the same time, development of youth is my priority where I can help them in growth because they are the future leaders. So if you ask my priorities, these are two of my essential priorities at the moment. But at the same time, there are other areas also that we can work along, but these are my two priorities at the moment.
Thank you. Dr. Mustafa Siddiqui, please, if you have any comment or question, would you like to, please? Thank you.
Thank you very much, Dr. Uzair, and thank you, Dr. Qidwai, for a very nice presentation, and it had many aspects to it. So one of the things which the question I had was that regarding the home health services. So I had practiced in Pakistan for 10 years before I moved to America. And I saw the contrast between the criteria for hospital admission in America and the criteria for hospital admission in Pakistan. And these were quite different. A patient is very sick when they get admitted in America. In Pakistan, I mean, many of the patients which would get admitted in Pakistan, basically, I would always think that they would benefit from home health services. They needed intravenous fluids or intravenous antibiotics, and if a nurse or a physician could manage that remotely, that would take away a lot of burden from the hospitals. So my question is regarding the home health services, how widespread they are, and is there a interest from the public sector in developing those services, or is it only confined to private sector?
Basically, what we are offering right now is into the private sector, and these are services that are focused on providing to those patients specifically who are elderly patients. And currently, we also have this product in terms of those people who are outside Pakistan. So like a cover for those people who are there in North America or other places where they have relatives and people like fathers and mother who are there in Pakistan and there is nobody to take care of them. So this is one of the uniqueness of this service that currently we are offering, where we take care of those elderly patients at home and provide them with all the services. But this is again currently at a small scale in Karachi at the moment, but we want to expand it and we want to develop application also for this purpose. So this is again as a private, but we are mostly focusing on the people who have their loved ones in Pakistan and who are unable to take care of them. So this is one of the areas we would like to bring over here.
Thank you very much. So I have a question. So like this initiative, there are many other similar initiatives up in the country, like in Punjab or other areas. So would you share some information about what about the network of such services? How many of them they are present in Pakistan? Is there any coordination effort really to bring them in one umbrella and improve like the partner sharing? You started from Karachi. There are a few others in other parts of Pakistan like Islamabad, and they started this activity say like 15, 20 years ago. And from the corporate maturity level, they have some experiences as well. So is there any mechanism of building this network, sharing the experiences and, with the transferable skill? So would you share your experience about that?
Basically, geriatric care, as I said earlier, is very limited in Pakistan, and few centers in Islamabad, KPK, and Lahore, and are offering these services. And if we can join hands together in expanding this throughout Pakistan and developing, I would say, an organization or something like that, where we can share our experiences in this area. So that is something definitely we can look into in future, where we can join hands with the similar organizations in other parts of the country, and maybe we can organize some kind of online conferences, or where we can invite people from APPNA also to present their findings, because currently, as I said, that geriatric care and elderly care is very limited. There are hardly any nursing homes, very few nursing homes. Even in Karachi, there are two nursing homes that are currently operating. So this is something where I would look for the experts from North America who have this expertise in geriatric care and elderly care, where they can help us and guide us in terms of expanding this area throughout service throughout Pakistan, and also suggesting us in terms of how this specialty can be expanded in Pakistan.
Thank you very much. So there is a definite role of lower tier trained staff like the health addies, like the personal support worker. And as of my information, there is no such institute in Pakistan who is providing such type of training. So if you have elderly at home, and it's very challenging to manage them about their mobility issues, about their personal hygiene and all other things. So your role is more, for example, is the strategic from policy to execution. Have you ever thought of developing some institution really to train these types of people with a defined curriculum from North America or any other developed countries like UK or for such reason? So is there any possibility to build the capacity at that level really to prevent the fall and all other associated things? So what's your take on that?
As I said, that we have a human capital development arm also, and we have envisioned that arm. But as you are saying, that the personal support workers and other programs that are not usually for Pakistan, they are not more common, as I said. Nurse technician program is also there. Physician assistant program is also there in US, which we hardly see over here in Pakistan. I think if we can collaborate with a health university or health institution in North America, where we can bring all those courses in Pakistan and then initiate such an institute, that would be a lovely effort that I think if we can achieve for, especially for the elderly care in Pakistan.
Maybe we can look to the possibility that we can provide you some academic material to start the personal support worker or health aide for the development of capacity, because that is the key issue, that first of all, you need to have the capacity to offer any such services, then a database. Then it's a little complicated because you have to verify their security background, because these are the vulnerable communities. And like the system over here is that they need to have the validation about their records. So these are the small activities, but I'll be in contact with you to offer you such type of intellectual support and material to be executed, which is well defined as per the North American system. And it covers most of all these things. So that's, we have with us Dr. Fareed Suri. Dr. Fareed Suri, can you please comment really anything you have in your mind regarding this presentation, please?
Thank you, Dr. Azhar. I think that was, it's a wonderful work that Dr. Qidwai is doing. And I think as Dr. Mustafa Saad Siddiqui pointed out, that it is seeking this home health care or this elderly care is one of the key things. I was just trying to figure out what is your, how you, it seems like you have a private sector role and a government, some kind of like a position. How are they, what's the role you have for in the official manner or in the government with the government?
No, I do not have any government role. I just completed my contract as a CEO for Sindh Healthcare Commission, established the commission, which is the
Okay.
regulatory authority in Sindh province. So I just completed my contract, and after completion, now I have taken this initiative to develop this center because I felt a need that such kind of requirement is there in terms of the healthcare sector. So that's why I have come up with this unique idea, and I'm trying to develop this concept of helping the youngsters in incubation centers for their business development and commercialization, at the same time human capital development in healthcare in various sectors. And I'm thankful, Dr. Uzair, for this offer. Currently we are offering the human capital development for the nurses and nurse technicians, but personal support workers and other programs that you have specified, I think that would be definitely something we're looking forward from your support. Thank you.
So in your slides, there was a UNET and then there was another logo. Was that logo also kind of like your private
Yeah,
organization?
as I explained earlier, that the current project of Center for Health Innovation Transformation is under my consulting company, which is Unit
Okay,
Consultants, and we
okay.
offer software skills development program and research services and project management. So that is my main consulting company. But under that, currently I have started this initiative of developing this center, and I am hopeful, inshallah, that I'll be able to develop into a formal company in due course of time.
The other thing I have is that the project that you mentioned about the cervical the cancer detection, that's you said it is a Canadian-based company that was kind of like what was the role of your company in that?
Well, since I'm a Canadian myself, and I have this Canadian colleague who is involved in developing this center, this product from UCLA. So that's how he contacted me. That since I have a public health person, he wanted my input into this project. So that's how I'm connected with him, and I'm helping him at the moment in developing of some kind of a focus discussions and some type of support in this area.
Thank you.
Thank you. Now we have some question from the participant, Dr. Qidwai. The first one is Mr. Imran Mirza. So he's asking, could you mention your top 3 strategic goals and give an example of tactics for their achievement for each of them?
Well, as I said, my top priority was to provide a platform for the projects and become a bridge between the academia and the industry. And for that, I have specified and I've given this example that I have come up with, where we connected the Karachi University Nutrition Department with the food industry. And we are setting a goal in terms of the project funding from with Pakistan Science Foundation. So we are submitting this project for funding, and this way we have helped out and provided a platform for connection between the academia and the industry. So that is the important thing that I want to mention over here. Second, as I said, that we want to develop ORIC within the universities setup, and for that purpose, I have signed an MOU with the Karachi University, and also Institute of Business Management is in process. So we are trying to help development of ORIC in these areas where the research incubation centers can be developed and supported by us. So that is important area that we are focusing on in terms of development. So ORIC development at Karachi University at the moment is one of the second important strategic focus that we are having. And the third, as I said earlier, that we want to develop youth and focus on their professional development. So the PF-KEET MOU that we have signed, we are just planning to develop a professional development center where we can develop their skills and also help them in their innovations in healthcare that they are doing.
Thank you. Now we have a couple of questions from Mr. Gul Muhammad Sanai Memon. The first question is that it appears your interventions are mostly in Sindh, Karachi. So do you have any interest and input from government of Sindh? And he mentioned that I work in Fertility Services, Geriatric Department, and would be very much happy to support with service development, capacity development. So these are the offering from Mr. Gul Muhammad. So would you like to comment, please?
Well, first of all, I would like to thank Mr. Gul Mohammed for his offering, and we will definitely look forward towards how we can collaborate with him. At the moment, I do not have any support from Sindh government. I'm doing it on my own, but at the same time, I am developing collaborations within Lahore with the Health Science University, and also in Islamabad with the Health Services Academy. So, and then fourthly with the KPK government in terms of their Director General Health. So these are the three other outreach services and contacts that I have established within Islamabad, KPK, and Lahore.
So just continuing, he's also asking that you mentioned about the Sindh Healthcare Commission. So he's not familiar about the scope of this government body. Have they any set priorities to establish geriatric services on their agenda?
Basically, Sindh Healthcare Commission was established as a regulatory authority like C.H.I.T in UK. So its main goal is basically to improve the quality of standards within the public and private hospitals. So their registration, licensing, trainings, and quality improvement is one of the main area of the Sindh Healthcare Commission. And the second important area is dealing with the quackery. I think we have more than 200,000 quacks in Sindh province only, 600,000 in Pakistan. So quackery is another issue that we are dealing with, and there was an incident in Lardana where earlier the HIV outbreak took place, and we took a very strong action over there when I was CEO, and we almost closed 400 clinics of the quacks in 1 week's time period in Lardana, dealing with the HIV/AIDS. So quackery is another issue that is dealt at the Sindh Healthcare Commission. The third issue is handling of the complaints, where people did not know earlier where to go for the complaints against the healthcare professionals, hospitals. So we have an online form available where any complaint that has to be addressed can come to the Sindh Healthcare Commission, and the complaint will be addressed, whether it is against any hospital or any medical doctor. So that is another area that the commission was established to ensure that complaints are catered over there. And fourth aspect is basically improving the training and clinical governance in the healthcare sector. So those are the four basic pillars of Sindh Healthcare Commission.
Thank you. There is another question from Ilyas Chaudhary, and he's asking, does Pakistan has any outpatient, inpatient rehabilitation programs, and therapists can train family for, or appropriate care and equipment for safe home stay? Psychiatrists could be of good resource to establish such services. So this is the question. And again, there is some reminder from some of the participants that please do share all your contact detail on the website, between the YouTube channels or the link, because that the people, they can contact you. So that's there. But would you please first respond to this Mr. Ilyas Chaudhary's question?
Yes, there are some rehabilitative centers I'm most familiar within Karachi as such. So there are rehabilitative centers available. And then another aspect is dealing with the street children and also those on the drugs. So I am currently working with some of the institutions which are engaged in rehabs in those areas. Some psychiatric centers are also there that are providing the service in rehabilitation. There is one trauma center also that provides rehabilitation service for the trauma patients. So there are definitely centers working, but there is a need for improvement and services as Dr. is offering. I think there is a lot of room for improvement and quality improvement in all these areas.
Excellent. So there is a very generous offer from Gul Mehman. He is an advanced nurse practitioner from Manchester, UK. and he will be happy to extend all his support if you are interested to build the capacity. So I'm going to share your contact detail to him, and then his contact detail to you and my contact detail, so that we can follow it up and keep it rolling and add some value to your initiative. That is really phenomenal, and these are some missing link on in our healthcare delivery. So because you are over there at a policy level as well, so access is very weak. If for any unfortunate reason you are bedridden and you have a mobility issue, there is no legal procedure, and the people, they are confined to their home. They cannot use the public facilities like the washroom. There is no mention about them, and for them it's like a home confinement altogether. So we need to enhance the role of such intervention to the policymaker and involve some other groups like the social welfare, and then at the policy level, that in the design phase, that they should make the access possible to all those people who are physically challenged. And now, they are developing like the washroom facilities on motorways and stuff like that. And there is hardly any concern. So the people who are really traveling for any reason, so they face a lot of challenges and problems. So it is a multiple angle, from policy to execution, we need to build the capacity and the knowledge. So this is just a comment. So I think we are almost done with most of the question. The final message you would like to give to the participant, and you would like to add something, please.
Well, the final message for all the participants, I am there for them to help guide whatever the way best that they want to bring improvement in healthcare sector in Pakistan. And this establishment of this center is basically focused on whatever best we can do in our limited lifetime. So I'm there to help, support, and do my best for all who want to deliver for Pakistan.
Thank you very much. Excellent. And really, we are grateful to all the participants for their valuable time, and they can claim the CME. And we are extremely thankful to Dr. Minhaj Qidwai for such a wonderful presentation. And with this, we close and say goodbye to all of you.
Thank you. Thank you very much. Thank you.